Hey Bernie, Tim Handren here, your mayor, and today is January 4th, 2021. Thank God 2020 is over. I wanted to bring you an update today that's pretty important. It's related to the vaccine for COVID-19. I know a lot of you have seen a lot on the news, and you're probably wondering what's going on in Kendall County, and we had some events that happened over the weekend. So let me just bring you up to speed on where we are. This is going to be completely managed at the state level. What I know is that the state's getting just under 500,000 doses of the vaccine every single week, and through the Texas Department of Emergency Management, TDEM is what we call them, they're sending that out across the entirety of the state, based frankly on population. Last week, there are two places that got the vaccine. One is the My Urgent Care Clinic on River Road. Tamara Perry runs that organization, and they got about 1,000 vaccines last Monday. They didn't know they were going to get it until the very last minute. And then HEB, right here in Boerne, got a couple hundred doses as well. As you might recall last week, it was called Tier 1A, which is mostly frontline responders, frontline healthcare workers. That was the primary target for round one of the vaccine. And I can tell you that in Kendall County, certainly for the city and the county emergency management crew, that happened pretty quickly last week. A lot of strong collaboration, lots of communication between the county, the city, My Urgent Care Clinic, and HEB as we got started with the vaccine distribution last week. On Wednesday, very quickly, the state said, hey, let's move on to Tier 1B, which starts to bring in the over 65 and high-risk crowd. And so that was mandated on Thursday. Let's start going out as quickly as we can. You may have seen that in the national news as well, that while it's not going as quickly as everyone wants it to go to, it's happening, and what we're doing in Kendall County and Boerne is working collaboratively with all the entities that are going to be delivering the vaccine. With that news, certainly on Thursday, I was on the phone with Olivia Burdick, who runs the Rainbow Senior Center at Kronkosky Place. She's working very closely with Tamara Perry at My Urgent Care Clinic, and they were working on basically a game plan that says, how do we get to the seniors quickly? We worked that through the weekend. Yesterday, on Sunday, an announcement went out. Kronkosky called all the people who they know, who they have phone numbers for. And we also put an announcement out on the social media pages from the city and My Urgent Care Clinic, and the chamber was very engaged in this as well, thanks to Kim Blum. So that word went out that you could call and make a reservation for today to go to the Kronkosky, and they were going to have 400 doses of the vaccine available. What I can tell you is the demand was exceedingly bigger than we expected. Within 2 hours, over 3,800 phone calls had come in, and there's a much higher demand than we have supply. So where we are as of today, that vaccine is being administered to the folks that got a reservation at the Kronkosky place. This will be the first time that we're doing it on a large scale. My Urgent Care Clinic still has some doses of the vaccine available today and tomorrow. They've set aside 100 and 120 respectively. And so you can continue to call them, but after tomorrow, all the known doses in Kendall County are going to be administered. That's the good news, right? So now the question is, what happens next? Kendall County is still waiting for their doses to be delivered, and we're on schedule to get 400 of those from the state. When are they coming in? I talked to Jeff Fink this morning, our emergency management coordinator, and he said he still doesn't know as of this morning when the state's going to send those to the county. And I would expect us to be able to deliver some news to you all shortly about what the next steps are going to be when the county gets theirs. In the meantime, My Urgent Care Clinic doesn't know when they're going to get more, and HEB still doesn't know when they're going to get more. Again, this is administered at the state level. I'm not pointing the finger at them in a negative way. They're just trying to manage a lot of information quickly. As the vaccines are being administered, the vaccinators have to enter data into a system for the state. And what they're going to try to do, it's my understanding, is continue to manage, okay, what about the second dose of the vaccine? Again, a lot more information is coming out. This is coming out very quickly. Listen, I'm very hopeful. The vaccine started to come out. As of tomorrow, we'll have had 1% of Kendall County will have been vaccinated. It's not coming as fast as a lot of people would like, but as it comes out, my promise to you is to continue to communicate and let you know where we can all go. Again, for the time being, it's going to be the Tier 1B and over 65 crowd. In the state of Texas, there are a little over 9 million people over 65, according to a phone call I participated in last week. And if the state is getting 500,000 vaccines per week, It's going to be about $1.6 million a month. So from what I can tell right now, based on the information I have, for the next several weeks, possibly 2 to 3 months, we're going to be really just vaccinating the over 65 crowd with the known quantities that are going to be made available. All right, that's the most important thing I wanted to make sure you knew today. Big thank you to Tamara Perry at My Urgent Care Clinic for being such a strong collaborator with the city and the county, to Olivia Burdick at Kronkosky for standing up basically a really important delivery vehicle at the Kronkosky place, to Kim Blum at the Chamber for being a great communicator, and to Jeff Finks, Steve Perez, and Nathan Taylor, all working with the county and the city. We are working very closely together to keep you informed. Stay tuned to the city's website, the county's website, and we'll just keep you informed as to what's coming. Happy New Year to you. Stay safe. Continue to not let your guard down. I know you're tired of hearing this message. I'm certainly tired of it as well. But we got to keep doing the things that make sense, and practicing physical distancing, keep wearing our masks. As tired as I am of it, as I'm tired, I'm sure you are of it, it's the best thing we can do right now until the vaccines can get out. All right, folks, have a great day, and we'll talk to you soon.